I'm a licensed psychologist and yoga educator with some specialty in stress reduction and resilience. Today we're focusing on sleep issues. In particular, let me introduce you to Sleep ASAP. We're a new international online platform to increase awareness and provide education on addressing sleep challenges from a non-pharmaceutical point of view. And we're very happy to have a guest presenter today to talk to us about one approach to addressing sleep issues from a non-pharmaceutical point of view. And so we welcome you. Thank you for joining us today, Aaron Arkin.
Hi there. Thank you for having me.
And I'd like to just give a little brief introduction. Aaron Arkin began studying sleep issues in 1998 and has spent his career in various aspects of the sleep industry. And he is, the initials are RPSGT, which stands for Polysomnographic Technologist. We'll let Aaron explain something of what that refers to. The accumulation of his experience working with different approaches to addressing sleep had led him to develop a program that he offers to people, which he calls the Evolution Sleep Program. And so we're interested to hear about that program, about that service, and let us begin now. So I want to ask you, Aaron, can you tell us in a brief way what the Sleep Evolution Program is?
Sure. So my program that I've done, as a Canadian, I've spent a lot of time crossing the country, and I visited most every sleep disorder clinic. And what I saw was that most of these laboratories do fantastic work with patients that have breathing disorders during sleep, specifically obstructive sleep apnea. But what I was seeing was that there was a subset of people that had a sleep issue, but there was no treatment out there for them that they were being given from these sleep clinics. So I did some research, and I saw the best way to treat these people and the recommended way to treat patients that were having behavioral type sleep issues was something known as cognitive behavioral therapy for insomnia. Cognitive behavioral therapy is used in many different modalities within psychology. It's used for depression and anxiety. It's used for phobias and alcoholism. And there's a branch of it that's specific for sleep. So one of the things that I've done is I've done some training in cognitive behavioral therapy for insomnia, as well as with my sleep background, and I've put together this program that's designed to help people who have these behavioral issues.
Great. So as a psychologist, I'm aware of cognitive behavioral therapy, but can you say briefly for the general viewer what cognitive behavioral therapy, which we'll call CBT, what that is or what it entails?
Certainly. Well, so cognitive behavioral therapy is a fairly common treatment with some of these psychological issues that we see every day. What it entails is it's discussing some of the thoughts and habits, so cognitions are thoughts and behaviors are habits, that people have that leads to maladaptive, in this particular case, sleep issues. So we challenge some of these thoughts with some of the research, and we challenge some of these behaviors with some modifications that allow people to understand their sleep better and ultimately be able to sleep better themselves.
So the kinds of sleep issues you do, would it be correct? I'm thinking of the types of problems that people might be coming to you with would be people who have difficulty falling asleep, people who have difficulty staying asleep, and would it also include people who feel that they're sleeping but wake up not refreshed?
That's correct. So you really hit the nail on the head there. We do see people that have a hard time falling asleep once they get into bed and turn the lights out. We see people that have trouble falling back asleep if they're awoken in the middle of the night for whatever reason. And we also see people that will wake up before their scheduled wake time and can't get that remaining amount of sleep. Either one of these three subsets lead people to wake up in the morning and have issues with their ability to function somewhat normally during the day because of the fact that they haven't slept optimally at night.
So what would a person expect from what, if I'm coming to you, what should I expect from a first therapy visit?
That's a good question. So, because my program itself is fairly novel, I outline everything within this first visit. We sit and we talk about what the program entails, and the first thing we do is we outline a fairly detailed sleep history questionnaire, where we do a one-on-one interaction, and we take the history of the patients to determine some of their sleep issues and some of their sleep patterns, at least subjectively what they are. In this first session, we also offer an objective clinical diagnostic tool where the patient will take home a very simple sleep device. I have one with me. It's called the sleep image. They take it home and they sleep with it, and it gives me a recording of what their night of sleep is like. So we get some data from their questionnaire, so their self-reported answers to the questions, as well as some objective data from the overnight sleep study.
Thank you. I missed that. You held something up. What is that tool called that you sent home?
This is a very simple recorder. It's called the sleep image recorder. It's 2 channels, so one electrode comes out the side, and a patient would wear it underneath their collarbone, and then one on one of their rib cage. And it gives a wealth of data about somebody's sleep, validated data, that allows us to make some determinations about what sort of sleep issues that they're actually having.
So what type of data does it collect?
Well, it collects several different parameters that are important to the study of sleep. It gives me some respiratory information and some EKG information. It gives me some, it has a built-in body position monitor, so it gives me some positional information. It has a built-in actigraph, so I can see movement time when a patient is awake and when they're moving and so on and so forth. It also gives me an algorithm called cardiopulmonary coupling. And what cardiopulmonary coupling is a measurement of how frequently that cardiac channel and the respiratory effort channels are coupled. The thinking is that when the heart rate and the respiratory rates are coupled frequently, then that's a sign of good quality sleep. And if they're coupled infrequently, that's a sign of poor quality sleep. So that's another measure that we can use to try to objectively increase throughout the course of the program.
So then once you put together the subjective and the objective information, then you design a program for them, a therapy program?
That's a very good way to look at it. The point is that throughout the course of the program, that subjectively they'll be feeling better, but objectively I'll also be able to show them that their parameters are improving throughout the course of the program. The device is used once a week, so every time they have a session, then they will go home with one of these devices. But we also utilize a sleep diary as well for the day-to-day subjective feelings. Many different data points subjectively, but objectively we're getting certain data points throughout the course of the program.
So part of the whole process is increasing the individual increases their awareness of their own habits and what's
Correct.
going on.
It's also not only increasing their awareness, but also decreasing some poor habits that they may have because of their poor sleep quality. One of the frequent things we see with patients that have frequent awakenings throughout the course of the night is that we can do certain methods to help restrict their sleep in order to get a more efficient night's sleep so they're sleeping properly throughout the entire night.
Beautiful. So what would you say, is there a typical time period that you need to work with someone in order for them to have benefit?
Well, the program is designed to be 5 sessions over 6 weeks. But usually patients that adhere to the program and can follow it fairly stringently start to see some benefits within the first 2 or 3 weeks. Some patients take a few more sessions when necessary, but most of the crux of the program is delivered in the first few sessions.
So this is a little bit of a challenging question, but you know, a lot of people that I've been talking to since working with Sleep ASAP say that they've tried everything and it doesn't help. Is there a percentage of people or a type of situation that need additional services in addition to the work that you're doing with them?
Certainly. Some patients that we see who seem to have a mild to moderate to even a significant level of anxiety, those are the ones that can be the most challenging. because essentially we need to try to teach these people how to relax better, how to focus some attention thoughts outside of their head in order for them to quiet their mind and sleep better. Some people can take to this very quickly. Other patients take a much more time to be able to do this.
So a person could come to you for more than 5 sessions?
Correct, when necessary. We do the aftercare as well where applicable. We do have some psychologists that are on board that can help where necessary too.
Great. So the one significant way that your program differs from just going to a psychologist who does CBT, cognitive behavioral therapy, is first of all, that you're experts on sleep issues and you've seen all kinds and dealt with all kinds of challenges, but also the combination of the objective data together with the CBT. Would that be fair to say?
I think that's very fair to say. Of the few psychologists that offer a CBT for insomnia type program in Toronto, nobody is really doing anything where they're looking at some diagnostic data as well. One of the things I speak about when I talk to family physicians, for instance, is that the analogy I use most often is joining a gym if you want to get in shape. And the sleep device is analogous to stepping on a scale. So when you're working out or when you're exercising, you try to weigh yourself every week or so. And when you see that positive feedback, oh, I lost 2 pounds this week, it makes you work that much better. My hope is that with my program, it does the same thing. When you see certain sleep parameters improving, that you're going to be a little more diligent with following the program.
Mm-hmm. And are you starting to collect data, or is there research before your program that shows the efficacy, the benefit of combining cognitive behavioral therapy with the objective data?
That's a very good question. Of the research that's out there with CBT for insomnia, there really hasn't been anyone that's measured the therapy with an objective diagnostic tool in conjunction. So there really doesn't seem to be much data that exists in the methodology that I'm doing so. Having said that, it seems to be a pretty ripe field to have some research conducted using that.
So we're open call for a university team to join up with you.
Certainly, there are a couple of psychologists and physicians in the Toronto area that have expressed some interest in doing some research along those exact same lines. So my background started in research, so I'm a big proponent of doing so.
So my last question is, or the last question, I think it's the last question. Do you find that after the 5 sessions or the maybe additional few sessions that somebody requires, are people able to maintain the benefit that they've gotten, or are you finding people coming back or contacting you saying it's 3 months out or a year out and I no longer I'm back to my old problems? What are you finding?
Well, there's obviously been 1 or 2 instances along those lines. But when I talk to people initially and when I promote each of these interventions that we use throughout the course of the program, I mention that they're tools for your toolbox. The point isn't that they're going to be able to have their sleep fixed for the rest of their life and they're never going to have a sleep issue. The point is more that they're given a set of tools that when they're having sleep troubles, be it currently, be it 6 months down the road, be it 5 years down the road, they know what it is that will work for themselves that will allow them to sleep a little bit better. I also often share what helps me sleep, and it's been helping me sleep for years. I focus on one particular object, and I close my eyes, and I focus on the outline of the letters of a particular word, and the next thing I know, I've fallen asleep and I've woken up in the morning.
Beautiful. I think that's really important that people understand that it's not like a magic pill, but it's a skill set that has increased their capacity to manage their own sleep experience.
That's exactly right.
Is there anything that I haven't asked you that you would like to add? I know you can talk for hours, but is there something that's pressing that you think would be really valuable for people to understand?
Well, that is a good question. There is something. Part of what I do in terms of the program that I put together is I also do as much sleep promotion as I can and talk about the benefits of healthy sleep. There doesn't really seem to be a population of individuals that wouldn't benefit from education in terms of how they can sleep better. My first few test patients were postpartum mothers, and once the baby was about 6 months old, it was the mother that was having some difficulty adjusting to a regular sleep schedule now that the baby was starting to sleep a little more consistently throughout the night. I've spoken to mommies groups. I speak to seniors about the senior sleep program. Executives, there isn't really any particular set of people that really would benefit from some sort of sleep education. Children and teenagers especially would benefit from learning more about sleep and learning more about what healthy sleep is and what healthy sleep would do for them in terms of how they can be more effective throughout the course of the day. Now, a CBT for insomnia program wouldn't necessarily benefit adolescents or teenagers because there's a component of the program that could involve some sleep restriction, which you don't really want to do with people of this age because teenagers and children need as much sleep as they can get. But the more opportunities there are to learn about sleep, I think we'd be better off as a people for that.
Thank you. Can you say briefly what you mean by sleep restriction?
Sure. So one of the things that we see with people who are having frequent awakenings throughout the course of the night, one thing we try to do is we try to delay their bedtime a little bit. By doing this, it can effectively build up that pressure to sleep so great that once they eventually are allowed to go back into sleep, or at least into bed, they fall asleep quickly and they can sleep much more efficiently throughout the course of the night without having any intervening awakening.
And you wouldn't want to sort of intentionally sleep deprive children or teenagers, right?
Correct, of course. They need as much sleep as they can get.
You mentioned populations from children through new moms, executives. Have you had the opportunity to apply this program with the elderly, the very elderly?
Well, one of the local physicians in Toronto and I are working on a program exactly for that, designed for seniors to help them with some of their sleep issues. It's not so much a one-on-one idea where we would be seeing seniors in larger groups to give them some more education about what it is in terms of their sleep and how their sleep changes as they age. So there is some benefit to us doing that, and that's a program that we hope to be launching within mid-fall sometime. But they're definitely a group that needs to understand that their sleep needs and their sleep quality needs will change as they age.
I hope we get back to you on that. I'm very interested in hearing how that goes and what you learn and how you're able to serve people. So my last question is more speculative, and I don't mean to put you on the spot, but it's really like an opportunity to think freely and based on your cumulative experience. Why do you think there's so much trouble and challenge with people sleeping? This is a normal function of the human of all animals, of all organisms. What are your thoughts on why there are so many people across the age range with sleep challenges?
That's a very good question, and there's no very easy answer. There's a few different comments, though, that I can make about it, which would explain some of the issues that we have. For one, we live in a 24-hour society, so there's so many distractions and there are so many conveniences that allow us to stay awake longer than necessary. Back in older times when electricity wasn't invented, when it was dark out, you would go to sleep, and when the sun came up, you would wake up. That's just how it was. Nowadays, we have lights that will stay on for 24 hours, and we can pick up our mobile phones, or we can turn on the television, and we can very easily be occupied for 24 hours. So that's one thing. Another thing that I've seen...
That's a big thing. That's a really big thing, I think.
That's a very big thing, both for adults and for teenagers and children. For them to pick up their phone and to text their friends or to play a game on their phone in the middle of the night robs them of sleep. So that's one very obvious one. Another one is the primary care physician level, is educating these physicians to let them know that there are certain programs that are out there designed to help people sleep better, but also to ask the questions about patient sleep. We've seen some research that shows up to 50% of patients that visit family doctors have a sleep issue that kind of goes undiagnosed, or at least hasn't been asked about. So the awareness at that level, at the frontline physician level, I think would also be very beneficial too.
Well, I appreciate very much all the work that you're doing in the field of sleep and helping the community. And thank you very much for your informative sharing with us today. And we hope to have you back another time.
It's my pleasure. I'd be more than happy to help.
Okay. And where can people find out more about you and your work and your services?
Certainly, they can find me on my website, evolutionsleep.com. I'm also available on Facebook, LinkedIn, Twitter, and so on. Those are a few different avenues you can get hold of me.
Evolutionsleep.com. Thank you very much. Sweet dreams to you.
Thank you.
Erin, can you tell us in a brief way what the Sleep Evolution Program is?
Sure. So my program that I've done, as a Canadian, I've spent a lot of time crossing the country, and I visited most every sleep disorder clinic. And what I saw was that most of these laboratories do fantastic work with patients that have breathing disorders during sleep.
Refers to the accumulation of his experience working with different approaches to addressing sleep had led him to develop a program that he offers to people, which he calls the Evolution Sleep Program. And so we're interested to hear about that program, about that service, and let us begin now. So I want to ask you on addressing sleep challenges from a non-pharmaceutical point of view. And we're very happy to have a guest presenter today to talk to us about one approach to addressing sleep issues from a non-pharmaceutical point of view. And so we welcome you. Thank you for joining us today, Aaron Arkin.
Hi there. Thank you for having me.
And I'd like to introduce that I'm a licensed psychologist and yoga educator with some specialty in stress reduction and resilience. Today we're focusing on sleep issues. In particular, let me introduce you to Sleep ASAP. We're a new international online platform to increase awareness and provide education. Just give a little brief introduction. Aaron Arkin began studying sleep issues in 1998 and has spent his career in various aspects of the sleep industry. And he is the initials are RPSGT, which stands for polysomnographic technologist. We'll let Aaron explain something of what that